Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I am your host, Toni Elhoms. Welcome to episode 68 of the podcast. Today is April 19th, and here we are halfway through April, and I just feel like 2021 is seriously flying by. So today I want to cover a topic that doesn't get a whole lot of visibility, but definitely needs to be on every coding professional's radar, and that's coding and reporting for gender dysphoria patients. So before we dive into our topic, it's time for your Monday dose of positivity, the Mindset Monday tip, and it's brought to you by RadRx. Are you interested in mastering a new specialty and going after a shiny new specialty credential? If the CIRCC is calling your name, then look no further. RadRx is your one-stop shop, go-to resource for all things interventional radiology. The Cracking the IR Code on-demand course is a turnkey guide to cracking this complex and highly compensated specialty. Make that investment in yourself today and visit radrx.com and mention my code ALPHA10 for exclusive pricing. So our Mindset Monday tip is all about hustle. You guys hear me talk about this all the time, but the quote I want to share with you says, "Dreams require down payments. Dreams are free, but the journey isn't. There is a price to pay. Many people start and few people finish. Many people have a dream and few people achieve their dreams." And I love this quote. It's by one of my favorite authors, John Maxwell. And it's just so true. You need to understand that in order to achieve something, you have to sacrifice something, whether that's your time, whether that's your money, whether that's the safety of your job. There's going to be something that's required as far as a sacrifice. In order to get something you've never had, you've got to do something you've never done. So growth is uncomfortable. It's not supposed to be easy. You get one life. You get one shot. Your dreams are free, but your journey is not free. It's going to be hard, and just know that it's supposed to be hard. So today we're going to cover my top 10 pro tips for navigating gender dysphoria coding and reporting. So this is a topic that I don't hear a lot of people talking about, but this specific patient population has needs, and we have to make sure that we're taking any personal bias out of the equation. And we actually play a vital role in facilitating this care by ensuring accurate code capture. So medical necessity, which is communicated through diagnosis codes, is often the make or break in the decision process when an insurance company is deciding whether or not they're going to approve care. So it's really important that you educate yourself about the specific needs of this patient population and remain objective. There have been a lot of cultural changes in society. A lot more research has been done and a lot more awareness and acceptance of the LGBTQ community. So this brings me to my pro tip number 1. Understand the clinical definition of gender dysphoria. So contrary to what a lot of people may think, gender dysphoria is not a mental disorder or a mental illness. And this is a pretty common misconception. So gender dysphoria is defined as a strong, persistent feeling of discomfort in a person who expressed gender conflicts with the gender assigned at birth. Pro tip number 2. Terminology matters. So specifically with this patient population, it's really important that you're sensitive to the terminology that's being used. So avoid certain phrases like gender identity disorder, transsexualism, transgender, any other offensive terminology. You want to avoid those as descriptors. Now, there are a lot of people that may say gender dysphoria is offensive, and I apologize to anyone if they are offended by that terminology. It is the terminology that's used in ICD-10-CM, but keep in mind ICD-10-CM was written a long time ago, and things have progressed significantly in terms of descriptors. So just be aware of this and be sensitive to it. If a patient requests that they are referred to with specific pronouns, then try to be respectful of those pronouns. Terminology really makes a difference. Pro tip number 3, the Affordable Care Act transformed treatment for gender dysphoria. So the ACA created mandates that private and public insurance companies cannot discriminate against people based on gender. So this rule required all insurance companies to cover all gender-affirming and transition-related care. Now, there have been some legal challenges to this interpretation, so it's not consistent across all payers. And also, the pre-existing status was removed for gender dysphoria patients. As with anything, the patient's policy is ultimately going to determine which treatments are covered, which treatments are not covered. And as revenue cycle management professionals, we all know every insurance company, every insurance plan is different and unique. So just keep that in mind. But prior to the ACA, this coverage was not in place for patients with gender dysphoria. So the majority of their care was either paid through grants, cash, or they went untreated. So we're seeing an uptick in the gender dysphoria patient population. And a lot of this has to do with the awareness and acceptance and, of course, the coverage of this care. Pro tip number 4, medical necessity trumps everything. So this is the golden rule. Medical necessity cannot be overstated in clinical documentation. And just keep in mind, a lot of the procedures and the medications that are prescribed to gender dysphoria patients require prior authorization. So the majority of medical necessity is communicated through comprehensive clinical documentation and the ICD-10-CM codes that are assigned for that encounter. As I said before, this can make the difference in the patient actually receiving the care that they need. So typical things that we would look for in a patient with gender dysphoria would be a psychological assessment from a qualified behavioral health provider that is experienced in gender dysphoria treatment, that there's a documented history of gender dysphoria that is ongoing and well documented. The patient can make fully informed decisions and is able to consent to the treatment. The patient is at least 18 years old and has completed 12 months or more of successful, ongoing, full-time, real-life experience in the desired gender. And then we would also expect to see that the patient completed 12 months of ongoing cross-sex hormone therapy that's appropriate for the desired gender unless it was medically contraindicated. And then, of course, the treatment plan would include ongoing follow-up care with a behavioral health provider that is experienced in treating gender dysphoria. So these are going to be typical clinical indicators that need to be present in documentation in order to support those prior authorization requests or if claims are denied. Pro tip number 5, establish workflows and protocols for recording data for gender dysphoria patients. So this is going to look a little bit different for this specific patient population, and it's imperative that you train your staff on how to collect gender identification. This needs to be done in a sensitive and confidential manner. It also needs to be done routinely because you just never know what's going on with the patient when they've decided to make that transition. And it's important that you collect the patient's current gender identification as well as the gender assigned at birth. This is going to be critical for claims processing. You can also set up fields in your electronic health record to capture what the patient's preferred pronouns are and then record that information. The really critical thing for claims processing is that the patient's gender marker matches what's on the patient's insurance policy, because what the insurance policy has is ultimately what's going to be required until the patient goes through the process of updating that with their insurance company. Pro tip number 6, know the appropriate ICD-10-CM codes for gender dysphoria. So keep in mind, ICD-10-CM was written in the 90s, and a lot of the terminology is already outdated, which is why we're hearing a lot of buzz in the industry about ICD-11. But just keep that in the back of your head as you're reading through some of these codes, because some of the descriptors are going to be words that I would advise not using. So take a look at code category F64. Look at all of those codes. There's many options depending on the specificity, but the ones that I see most commonly reported are going to be F64.8 and F64.9. So this is going to be for other specified gender dysphoria and then gender dysphoria not otherwise specified. You'll also want to be familiar with code Z87.890 for history of sex reassignment surgery. Pro tip number 7, report appropriate comorbidities. So these patients often deal with many other medical conditions. So it's not uncommon to see patients that have gender dysphoria also have depression, anxiety, struggle with substance use, substance disorder, substance abuse, and conditions like schizophrenia with or without suicidal thoughts, and have a history of prior abuse, prior assault, prior trauma. These are very important diagnoses that need to be captured from a data standpoint to accurately describe what's going on with the patient and their severity of illness. So make sure to capture all of those comorbidity and personal history codes. Pro tip number 8, understand the common services reported for gender dysphoria patients. So the majority of the time you're going to see, of course, evaluation and management, so CPT codes 99202 through 99215. And then oftentimes these patients require extended counseling, extended care. So you want to take a look at the prolonged service code, CPT code 99417. I did a previous episode about prolonged services entirely, so definitely go back and listen to that one. And then targeted counseling, so codes 99401 through 99404, and then the group therapy codes 99411 and 99412. Those are also pretty common as there are a lot of gender dysphoria support groups. And then voice therapy, so codes 92524, 92507. Talk therapy, that's going to be in the psychotherapy code section. And then when we look at actual procedures, there are breast surgery procedures. So you'd look at 19303, 19325 sections, and then genital surgery. So codes 55970, 55980. Definitely take a look at those and familiarize yourself with those services. Pro tip number 9, know what procedures are considered cosmetic for gender dysphoria patients. So certain procedures are going to be considered cosmetic regardless of the severity of gender dysphoria. So things like rhinoplasties, hair removal, hair transplant, facial feminizing surgery, chin lift, chin augmentation, mastopexy, lip reduction or lip enhancement, liposuction, all of these procedures are going to be considered cosmetic if it's only for the purpose of treating gender dysphoria. And of course, this is not an all-inclusive list, but these are some of the most common that I've seen for gender dysphoria patients. Pro tip number 10, append the KX modifier when appropriate. So the KX modifier is recognized by many insurance carriers, but it's a special modifier that alerts the carrier that the gender or the procedure or the gender and diagnosis may have a conflict at it and that it's not an error, it's actually a valid claim. So the KX modifier helps bypass those built-in edits. And if you look at the description of the KX modifier, it just says that the requirements in the medical policy have been met. So it's not an error, it's a pass-through claim. So grab a pen and paper to summarize my top 10 pro tips for navigating gender dysphoria coding and reporting. Number 1, understand the clinical definition of gender dysphoria. Number 2, terminology matters. Number 3, the Affordable Care Act transformed treatment for gender dysphoria patients. Number 4, medical necessity trumps everything. Number 5, establish workflows and protocols for recording data for gender dysphoria patients. Number 6, know the appropriate ICD-10-CM codes for gender dysphoria patients. Number 7, report appropriate comorbidities. Number 8, understand the common services reported for gender dysphoria patients. Number 9, know what procedures are considered cosmetic for gender dysphoria patients. Number 10, append the KX modifier when appropriate. So it's time for this week's coding pro tip, and it's brought to you by Contempo Coding, which is an on-demand educational resource provider created for coders by coders. They specialize in affordable coding certification prep courses to help you accelerate in your career. Right now, they're offering an exclusive special to Alpha Coding Podcast listeners, and that's $125 off the Certified Risk Adjustment Coding Prep course, as well as some great bonus content when you order through our affiliate website. This course has a 100% pass rate, by the way. Visit our website, alphacodingexperts.com, and head over to the Deals and Discounts tab for a link to take advantage of this absolute steal of a deal. If you have a coding-related question and would like it to be featured in one of our coding pro tips, please reach out to me on LinkedIn, Facebook, Instagram, or YouTube. So this week's coding pro tip comes to us from Ohio. Hi, Toni. Thanks for putting this show together every Monday. I know it's a ton of work, and we really appreciate your content. My question is regarding ophthalmology coding. The doctor that I work for wants to report eye evaluation codes only because the reimbursement is higher than if they use the standard evaluation and management codes. But is this okay? Well, first of all, I want to say thank you for your support of the podcast. So with anything, it's always important that we code according to what the provider's doing and not what gets paid higher. And I know this can make you an unpopular person with the doctor, but you just have to stay firm in that it's not about what pays higher. It's about compliance for correct coding and billing rules. So I think there's going to be instances where the doctor would use the I codes, and there's going to be instances where the doctor should use the standard E&M codes. It really all depends on the circumstances of the patient. So let's say that the patient is coming to the ophthalmologist to manage their diabetic retinopathy, and this is a chronic condition. It's most likely going to lead you to the standard E&M codes. But what you don't want to do is use the I code, so code 92012, for example, for a follow-up of, let's say, a corneal abrasion. That would be more appropriate for, let's say, a 99212. So the short answer is that it really just depends on the patient, and I would strongly advise your doctor to use the appropriate codes that reflect the service that they are providing and not what pays higher. I hope that points you in the right direction. Please remember to hit that subscribe button now so you never miss another episode. Also, be sure to drop us a 5-star rating and review on iTunes. We really appreciate your support. So this concludes today's episode. Until next week, thank you for listening to the Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.